So the blood pressure of the patient is 190 over 100, and lowering the blood pressure right now could be the mistake. So let's get into a case. You have an 83-year-old man who was sent from a pharmacy for elevated blood pressure. This patient does not have any chest pain, no neurological symptoms, no shortness of breath. What matters? What matters is not the number only, but whether there is target end organ damage. And what we are talking about is hypertensive emergency. It means severely elevated blood pressure, usually above 180 over 120, plus signs of end organ injury. Now, the end organ injury could be signs and symptoms of stroke, chest pain because the patient has ischemia, acute heart failure, kidney injury, and you realize that none of these end organ issues are present in this patient we are really looking at right now. So this is a patient who is asymptomatic with uncontrolled hypertension. And you do not need to drop their blood pressure rapidly in the emergency department because the body has adapted to that kind of pressure, which is so elevated. Now, if you rapidly lower the blood pressure, it will cause a decrease of blood flow to the patient's brain, a decrease of blood flow to the patient's heart, and a decrease of blood flow to the patient's kidney. So how will you manage this patient? You need to make sure that this patient is on appropriate antihypertensives and the patient's blood pressure comes down gradually in a stepwise manner. You want to do something like an ambulatory blood pressure monitoring and consider oral therapy depending on the patient's comorbidities, and the comorbidities vary. And in other lectures, I will go into other strategies for patients who are symptomatic. Remember, this particular patient, it's not symptomatic. He just had elevated blood pressure and he did not have any evidence of end organ damage.